We are delighted now to be joined by Dr. Michael Pizzimenti. He's at HealthQuest. He is at HealthQuest Physical Therapy in West Bloomfield. It really isn't a mouthful, Dr. Pizzimenti, but I just got tongue twisted there. Hey, thanks for joining us via Zoom. You look great, Doc. How you doing today?
Thank you. Not doing too bad, just trying to manage with the times.
So, I set it up there. There's a whole financial picture. We're going to continue to talk about the medical issues, but there's a whole financial picture for the hospitals who are not doing the elective surgeries that really help fund their entire operation, and to physicians like you operating out of their offices all around Metro Detroit. So you're in the physical therapy area. How's it going? Can you talk about that?
Yeah, we're dealing, especially with physical therapy, dealing with, close to around 75% to 80% reduced capacity. I own and operate our location in West Bloomfield, and, like most of our locations, we've, our staff right now is kind of on standby. The directors and owners have kind of shouldered the burden, taking care of the remaining, patients that are still coming into the clinic. We are working limited hours and limited days. Treating high priority patients, post-op patients, or patients that truly need the physical therapy, the hands-on part of it. But we are, we're dealing with significantly reduced volumes right now, during the crisis.
Would physical therapy and the operations in your office be, I assume it's an essential service, and you can have people come in if they want, or are you not inviting people into the office right now?
We are, to a limited capacity. So, before we could have, up to 10 to maybe 15 people in the clinic at one time, between employees and clientele. Right now we're dealing with maybe 3 to 4 max at a time. We're treating only in separate private rooms, keeping people separated in the clinic. We're sanitizing every piece of equipment touched right after its use. Just heavy hand sanitizer. I heard you talk about the Clorox wipes. It's the same thing with them trying to get those out of the bottles. Can be, especially the first sheet. You can try to dig for first sheet. Can be tough.
It is. I'm glad that I'm not the only one having trouble with that.
Oh yeah. So we are dealing. We were lucky enough when this first started to be a little bit proactive and we ordered a large quantity of cleaning supplies. So we're now starting to, use a lot of the stock that we had, but right now we're not running into too many issues as far as cleaning supplies go, but we are heavily sanitizing everything. We also have expanded our treatment into, so this is more lower priority or patients that could get by with some home exercises or education. We are getting heavily into telehealth. I know as a hands-on field physical therapy it can be tough, but over the last 2 to 3 weeks, we've really refined how we've approached the situation. And, I'm heavy on education. I think physical therapy should be heavy on education as well, to let these people know that we can help them out, help them move better, and give them an exercise program that can be appropriate for them as well. So these are for patients that
come on, tell us the truth, Dr. Pizzimenti. You physical therapists, I know, you guys, you all have a little bit of MacGyver in you. You send us home and say, well, what you're going to do is lean on the edge of your couch like this and spin around 7 times or whatever. You can do some therapy like that and work with people in their home using the tools and exercises, leaning up against the wall or whatever they would do. Maybe, are you deploying a lot more of that kind of thing?
Yes. So the good thing about telehealth is, it's a video chat. So we have the ability to see how the patient moves, what exactly is bugging them by them even pointing to the spot, showing us the movement that hurts, and then showing us around their house things that they might be able to use to help stretch, mobilize, give their self-massage. I mean, it's talking about MacGyver, right? Having people back up into a doorknob to rub out a knot and, their glutes or low back or something. It can be something as simple as that. Also pointing them in the direction of, purchasing some potential supplies. I have people that have exercise programs prescribed to them. I say, hey, swing by the clinic. We'll cut you a couple bands. And so then they can actually bring some bands home and then work from home with those pieces of equipment. It's limited, but we're making the most of what we can.
Is your business going to make it? I know a lot of businesses, they're really worried that the loss of revenue over a protracted period of time puts them in danger. I don't want to ask anything confidential. I'm sure you're going to figure out a way to get through this, but could you tell us how you're doing and how you're coping and some strategies you're working on?
Yeah, like all small businesses, we're hurting too. Thank God we're in the healthcare field. So yes, we have taken a huge hit. The company has been around since '99. We're a great company run by run by two great individuals. We're gonna make it through. It's gonna be a while. We don't know when this is gonna end either. Obviously, the longer this goes on, the more hit we're gonna take. Right now, working at limited capacity, not having the overhead that we had before right now is helping. But the longer this goes on, the more it's going to hurt. We're going to come out of it. We just don't know when. But physical therapy it's a service that's not going to go away, and it's popular. People are trying to avoid surgeries or recover from surgeries, dealing with degenerative issues like arthritis. People are always going to be in pain, so physical therapy will be around. Just it's going to take a while to build back up the volume. I mean, I could see this going into next year to be able to say that we are mostly recovered from this.
Dr. Michael Pizzimenti joining us from HealthQuest Physical Therapy. Are you seeing stress-induced pain as well? And can you treat that with physical therapy, or does that all have to be with our previous doctor, Dr. Schwartz, on the psychological side?
So that kind of goes back to, what I was saying before with education. Believe it or not, when we see patients 2 to 3 times a week and they're in the clinic for, an hour or so, it's more than just physical healing. There's a lot of talking, there's a lot of motivating, there's a lot of picking up. There's a lot of pushing patients to kind of, optimize and reach their potential. So when patients do come on in, and yes, I have seen a lot of the stress-induced pain, it's a matter of calming down and trying to find strategies, in their life outside of the clinic to help cope with this and help them feel a little bit more empowered. Right now, we all kind of feel in a state of hopelessness that we can't really help what's going on out there. So if I can educate somebody and show somebody some ways to kind of manage their pain and kind of take control of that, it does help patients psyche a little bit more. So yes, there's a little bit of an educational piece to that, and we have been dealing with patients.
Last time I was with a physical therapist, it was prescribed by my other general physician and other specialists. Do you have to have a prescription to go to a physical therapist, or can we just, if we're having some pain issues, just start with you, or would it be always the advice of another doctor?
So there's a couple avenues you can take. So we do free consultations or pain assessments. So if somebody, out there's in pain right now and just wanted to ask me a few questions or have a consultation where they see me in person, we can also do a telehealth consultation, completely free of charge. So I can take a look at you, assess the movement, and basically we can decide 2 things. One is, you can, in Michigan, the state of Michigan, I can see somebody up to 10 visits. It'll be outside of insurance. I can see somebody up to 10 visits legally without a doctor's prescription. After that, though, or if they wanted to go through insurance, we would have to have a prescription from a physician. Yeah. And there's a great team of physicians that I know out there, and we do work together. So as I see somebody coming in that's been having pain, I have the ability to refer them to one of the trusted physicians that I work with.
All right. Well, I appreciate your time today, and I just want to let you know that physical therapy has played a big part of my life. I had some real problems with my back after skiing accidents when I was younger, and I couldn't walk. I mean, I could not walk for a while. And physical therapy, I'd never had back surgery. Physical therapy has me on my feet every day, and I've been using those strategies for most of my life, and it's worked great for me. So thank you to you and all the other physical therapists out there that are helping folks like me each and every day, and especially during this crisis. I appreciate you joining us, and thanks.
You're very welcome.
All right. He is Michael Pizzimenti with HealthQuest Physical Therapy, joining us via Zoom today here on the Megacast.